Hi, it's Chris. Welcome back to Basic EKG Interpretation for Healthcare Providers. We're going to go over Chapter 8 now and cover heart blocks. So don't forget your 5 rules and let's get into it. So, heart blocks, as you can imagine, this is a situation where the conduction from the sinus node down to the ventricles, somewhere there is a block in that conduction. But to be honest with you, it's not just a block, right? So this X there is indicating, somewhere the pathway is being interrupted. But in addition to blocks, it can also be a delay. All right, so we'll discuss that with our first rhythm that we get to in this next slide. But just understand, if your P waves do outnumber your QRS complexes, you can be pretty certain that there is some kind of a block that is of a second or third degree nature. All right, so let's make sense of all this. First degree heart block. You're going to see that I have highlighting at the top of each one of these 4 rhythms that we're going to go over. So pay attention that first degree heart blocks have equal PR intervals. So let's get into our 5 rules. All right, so let's measure our distances going across from R to R. They are identical all the way across this. We got a couple of calipers there, but if we added a few more, you would see that they're all about 20 boxes apart, giving us a rate of 75, and it's regular. So next we get into our P waves, and you can see all of our P waves look the same. They are of the same morphology, okay? But the PR interval, which is measured here with these calipers, if I had those before each one, they are all the same as well. So we have normal P waves, but we have long PR intervals, all right? Our QRS width is next. It is less than 0.12 seconds, so the QRS width is normal. So we interpret this as a first degree heart block. And again, I emphasize, all of the PRIs are equal, but they are longer than 0.20. So let's get into our next one, which is second degree heart block type 1, commonly known as Wenckebach. Wenckebach is one of the researchers from well over 100 years ago that was looking at the conduction system and doing research, and he discovered that there was a pattern that occurred sometimes where you would have PR intervals that gradually got longer and eventually did not result in a ventricular depolarization. So let's take a look at our 5 rules and put it together with this rhythm. So we're measuring the for regularity, and we can see those calipers are the same. So we have some regularity there, but then we throw a couple of other calipers in there, and we can see that it is very close, but slightly off. And then we have this obvious gap in here, and this obvious gap over here as well. All right, so we have an irregular rhythm, but there's some regularity to it. So we could call it regularly irregular. We get a rate of 60 just by counting those complexes and adding 0. And then we get into the P waves. So look at all these P waves. Same morphology, right? They are all upright, round. They all look identical. So our P waves are normal. However, we have this PR interval that is elongating. There's our first set. Then we measure again, and then we measure a third time, and you can see it's growing, growing, growing until we have a dropped complex right here. There is no QRS complex after this guy, and there's none after this one here. We don't have much information on that one, but we can assume that this pattern is occurring over and over again, and that's what Wenckebach discovered. All right, so don't forget about the QRS width, and we call that one Wenckebach. Going back to this one real quick, you can call it a secondary heart block type 1. We're in emergency medicine. A lot of times things have more than one name, right? But I refer to that one as Wenckebach. It helps to distinguish it from this rhythm. Note at the top, we have some highlighting. You've got a PR interval that is equal. Very important to remember. We're distinguishing this rhythm from the previous secondary heart block as well as a third degree heart block coming up. All right, so let's measure for regularity. We can see in this case, we have an irregular rhythm. I will tell you, in some ways, this secondary heart block type 2 has it's somewhat similar to atrial flutter in that you can have a regular rhythm. You can have a 2-to-1 or a 3-to-1 conduction, just like atrial flutter, right? You get 2 or 3 of those flutter waves, and going consistently across, and that rhythm will look regular as well. So sometimes the secondary heart block can be regular, but in this case, it's irregular, pretty obviously as well. So the next thing we do is look at the P waves. They are all upright, round, and identical in morphology. So our P waves are normal, but we get into our PR intervals and we note that they are also equal. However, some of the PR intervals are not measurable because there's a dropped complex after them, right? So we have more P waves than QRS complexes, so we know we have some kind of a block. But because our PRIs are equal and we have dropped complexes, we call it a second degree type 2. Second degree heart block type 2 or Mobitz type 2. Don't forget about that QRS width. We want to measure that as well. Okay, you can have a secondary heart block type 2 with a wide complex QRS. That's not something that does not exist. You will come across those as well. All right, so let's get into the final one, which is a third degree heart block, sometimes referred to as a complete heart block. Note the highlighting at the top. You are going to have unequal PR intervals with this one. However, let's look at the regularity. It's perfect. Look at this. 1, 2, 3. All of those are the same distance apart, which is 40 of those small boxes. All right, so that gives us a rate of approximately 38. So it is a regular rhythm. That is a common characteristic of a third degree heart block. Even though this rhythm can be very dangerous for your patient because they tend to be pretty slow and the person is just not perfusing efficiently. But that being said, it is regular. Okay, so we have normal P waves. All right, the P waves are upright, round. Sometimes the P waves are mixed in with the T waves or QRS complexes, and they're a little bit hard to see. But the ones that we can see are all the same, so I call them normal. And there are more of them than QRS complexes. PR intervals, when we look at those, they are all different. They're all over the place here. Every once in a while, they will kind of look like they're elongating. The way that you distinguish this third degree heart block from a secondary heart block type 1 is that the PR intervals here are not progressively getting longer and you have a regular rhythm. Whereas with a second degree heart block type 1 or the Wenckebach one that we discussed, you tend to have these groups of beats. So with this one, you have a QRS width of 0.08. So we call this one a third degree or complete heart block. All right, let's take a look at these P waves marching out. See how they are all evenly spaced apart? All right, that is a common characteristic of this third degree heart block. Essentially, the top of the heart is doing one thing and the bottom of the heart is doing something else. There is no cohesion there. And that is a characteristic of a complete heart block or third degree heart block. Can be a dangerous rhythm, so be careful about these. Again, you have a regular. This rhythm tends to be regular, but with unequal PR intervals. All right. A quick little tip with these, and if you Google, you know, heart blocks, you'll see a lot of different things. There's poems, there's stories that people have made up to make these things easier. But a quick way to narrow these down, at least to give you a 50-50 shot, is to determine if those PR intervals are equal or unequal. If they are equal, you either have a first degree heart block or a second degree heart block type 2. All right. And then once you get to that point, it's easy to distinguish those because the first degree heart block has a QRS complex after every P wave. All right. And then when you get into the unequal PR intervals, you either have a second degree heart block type 1, which is called the Wenckebach, or a third degree heart block. If you have a second degree heart block type 1, the rhythm tends to be irregular. Okay, whereas the third degree heart block tends to be regular, and that hopefully that tip helps you with distinguishing the different types of heart block. And remember, the more that you practice, you'll get better at these, and it'll become like second nature to you. All right, so that's it for chapter 8. I will see you next with chapter 9, where we will discuss paced rhythms.